Greetings, fellow tarot travelers, tripping through the tetrahedral triptych of cards I shall lay before you. I'm Tarot Torch. And now we're going to discuss the country of Myanmar. Myanmar had a previous name of Burma, and this discourse is going to be about the health problems and the professional health services of Myanmar. Myanmar is a country with an area of 680,000 square kilometers, roughly twice the size of Japan, and is surrounded by Thailand, Laos, China, India, and Bangladesh. Myanmar's population as of February 2019 is 54,169,504 people. In 2014, Myanmar did not have enough medical doctors, with only 61 doctors per 100,000 people of the population. The number of medical students was reduced from 2,400 to 1,200 in 2012 to ensure the quality of medical education. Private health statistics in 2015 by the Department of Medical Services reported that there were 193 private hospitals, 201 private specialist clinics, 3,911 private general clinics, and 776 private dental clinics, mostly used by the government employees, the military, and the rich. In Myanmar, charity hospitals run by private sectors are operating for the poor. There are private nonprofit clinics run by community-based organizations and religion-based societies, which also provide ambulatory care. Among them, some have developed to provide inpatient care. Almost 70% of the population resides in rural areas. Basic health staff are the main health care providers for them. Generally, each rural health care center, known as an RHC for our discussion, each RHC has 4 sub-centers. The staff is made up of 1 public health supervisor, grade 1, at the RHC, 4 public health supervisors, grade 2, 1 at each sub-center, 5 midwives, 1 at the RHC and 1 at each sub-center, 1 lady health visitor at the RHC, and 1 health assistant at the RHC. The basic health staff is responsible for maternal and child health, clinic or home care, school care, nutritional promotion, immunization, community health education, environmental sanitization, disease surveillance and control, treatments of common illness, referral services, birth and death registration, and training of volunteer health workers, both community health workers and auxiliary midwives. These health workers face many challenges in their effort to reach out to the remote villages with meager resources and support. What is lacking from this list are surgeons, dermatologists, gynecologists, doctors. It would be a mild understatement to say that over the last 50 years, healthcare outcomes in Myanmar have not kept pace with those of its neighbors. As the last country in Southeast Asia to open to foreign investment, by 2013, healthcare in Myanmar was suffering badly from over 50 years of neglect. When the World Health Organization, the WHO, last ranked Myanmar's system against its global counterparts, the country was pegged dead last out of 190 countries with respect to what the WHO calls overall health system performance. In 2015 through 2019, Myanmar spent roughly 2% of its GDP on healthcare. That's only 2%. Impoverished Laos spends 4.5%. Cambodia, 5.6%. Because of the pitiful amount of money the government has historically spent on healthcare, Myanmar continues to struggle with basic problems related to communicable disease. Malaria is the leading cause of morbidity and mortality in the country. Many of these deaths occur from a drug-resistant form of the disease common along the country's border with Thailand. TB rates in Myanmar are estimated to be 3 times the global rate, and the majority of cases are drug-resistant. Many poor-quality medicines are supplied to patients, mainly in developing countries. No systemic survey on counterfeit medicines has been conducted in Myanmar since 1999. Samples of oral medicines and injections were collected from pharmacies, hospitals, and wholesalers in Yangon, Myanmar in 2014. Authenticity and quality were verified. There were 221, or 94%, foreign medicines among the 235 collected samples. 5 samples were not registered with the FDA of Myanmar. In quality analysis, 36 samples out of 177, or 20.3%, did not pass quantity tests. 27 samples out of 176, or 15.3%, did not pass content uniformity tests, and 23 out of 128 samples, or 18%, did not pass dissolution tests. 3 of the unregistered GM samples failed in both identification and microbial assay tests. Counterfeit generic medicine is being sold in Yangon. The cost of seeking private health care in Myanmar is often enough to push poorer households into vicious cycles of poverty and illness. While urban populations generally have more access to health services than people in rural areas, there is still a large gap between the poor and the non-poor households. As a result, many health issues that could be easily treated are neglected until the problem is much worse. We see more and more people from peri-urban slums coming into large cities for second or tertiary treatments because they could not afford to take a day off or spend their earnings on health care when their disease was still treatable at the primary care level. Hypertension or high blood pressure is a common condition in the elderly that can be easily managed with the right medication. However, failure to seek treatment can lead to a heart attack or stroke. In poorer communities, many people neglect their illness or fail to have it diagnosed at all, simply because they cannot afford to seek treatment. Instead, they go to the local pharmacy and typically purchase painkillers or anti-allergens. Over time, the condition worsens. Tuberculosis, malaria, pneumonia, hypertension-related illnesses, and self-induced abortions are primary killers. Dengue fever is now beginning to spread in Myanmar. Will Myanmar develop medical resources or accept international help? Will Myanmar increase medical education admittances? Will the World Health Organization intervene in Myanmar to stall the global spread of serious illnesses like tuberculosis? Will this health crisis challenge the elitist class structure of Myanmar when the upper classes begin to die of these communicable diseases? Well, these are very big questions, and they are questions for which we have no answers. And when there are questions for which we have no answers, it's a good time to ask the tarot cards. They may not have the answers, but they will certainly lend insight into our dilemma. Today's deck that I've chosen is called the Antique Anatomy Tarot, and this is the Ephemera edition, created by Claire Goodchild. This is a very, very interesting deck that's part tarot and part pictographs of an anatomy class. It does have a lot of skeletons involved in it, but that's only because it's pointing to the majesty of the human body from a medical viewpoint. And since it does have this surreal sort of medical viewpoint, I decided to use this deck for our tarot reading. And of course, because the backs are black, they blend in with the table and are a little hard to see. But remember, we're doing these cards face up. So we'll cut the deck and see what the cards have to say. I'll put the cards here to the side so you can see the cards vaguely. I know they're black, but that maximizes the room for us to work in. And the first card is the Seven of Blades. And as you can see down here, it tells us the suit, and then it says figure 7 blades. Almost like this is some kind of antique portraiture or picture. Actually, it's something that you'd find in an old medical text, and something done with copper plates when they made the pictures. Now, the Seven of Blades has many interpretations, but it ultimately represents sharpness and the ability of mind to create strategy. It has to do with mental alertness and finding a solution through the mind. The second card in today's reading is going to be, another one from the Blades. And this is the Six of Blades. That's interesting. And we'll put that one here next to it. And at this point, we have a descending order of cards. And the Six of Swords represents, or blades in this case, represents adapting, making changes. You know, the medical world does need to adapt. There are many resources at our disposal for impoverished regions like this to improve health conditions, like herbology indicated in this card and even the previous card. And the Western world seems to throw out herbology or medical massage or acupuncture, thinking it's just baloney. But in fact, for thousands of years, it's been a wonderful method of curing people and has a long track record of wonderful results. And in impoverished regions, before we're able to set up an infrastructure, you know, if a surgeon arrives in Myanmar, he can't just perform surgery. There's no hospital. There's no staff. There's no equipment. We need to start somewhere. And we need to have a strategy to heal the people and save their lives. Not just by injecting them, but we need to cause them to have healthy constitutions. And I think that being able to employ herbology and making adaptations like this to the Western medical protocol would be helpful at this time to help these people until we can get an infrastructure going so that they can have proper medical care. And the final card, another blade. Boy, this speaks a lot about surgery, doesn't it? And this is the Ace of Blades. And so what we have here are 3 cards that deal with intellect and mind. And it's a descending number, which means the problem's getting worse before it gets better. You know, even if we sent in Doctors Without Borders, there's no lights. There's no clean environment. There's no place for these people to operate. And obviously, these people need operations. Oh my God, can you imagine being in Myanmar and you're having an appendicitis in the countryside and the only person who's semi-qualified is the midwife? I mean, people die of the simplest things. And communicable diseases go rampant because they're unable to give the people proper inoculations, and the people don't have proper hygiene because they don't have proper education. Look, if we're going to solve the problem of Myanmar, the first thing that's being spoken of here is that we have to educate the people. The people need cross-the-board education, and they need to have hygiene taught. They need to know what bacteria is and microbes are. They need to know dirty water from clean water. They need to know how to cook, to clean the food through high temperature. They need to know basic colloid chemistry to know how to make a sauce. But the point of the matter is, we need the people educated. Through education, you end up with people who live lives that are cleaner and less likely to spread disease. We need to adapt the medical system. They don't have an infrastructure. Let's integrate into it things that'll work right now, today. We can give them herbal medicine, acupuncture medicine, medical massage, physical therapy. There are many kinds of chiropractics. There are many kinds of really helpful tools in medicine that can be employed without having hospitals and infrastructure. We can teach the people to raise medical herbs. We can teach them how to cook them and prepare them and keep their vitamin content higher. This will make them healthier. Even if they need an operation, they'll be in better condition for the operation. And we need to have an intellectual approach. We need the World Health Organization to say, look, this is the number of people, this is the number of hospitals we need. You can't have a country where 80% of the people have a midwife and someone dressed in nurse's clothing that's never been to medical school serve the community. This is insane. We need to get these people cared for. These are nice people. The people of Burma, oh my gosh, the ancient ruins, the beautiful Buddhist monasteries and temples. These people have a rich and very valid history. And somehow, through corruption of government, they have been stripped of their human decency. And we need to return their decency. We need to step in and give to these people the medical care they need. It's a basic human right. I mean, people complain about not having free medical care in the United States of America, and it's horrifying what happens here. Imagine Myanmar, where there isn't a hospital to abuse the emergency room with when you don't have medical insurance. They have no medical insurance, they have no doctors, they have no free clinics, they have no hospitals. They don't have this in Myanmar. And they have a small staff that is overburdened with menial tasks that don't address the fundamental health issues. These people can't conduct appendectomies. They can't conduct spinal surgery. They can't correct eyesight and do cataract surgery. They can't perform periodontal surgery or even basic dentistry. You have basically a nation with no medicine and no dentistry. How shameful that is. And so we need to have a strategy. We need to adapt for their needs and implement right away. And that's what the cards are truly saying. And we need to set up surgical centers where people can go for urgent, immediate medical care. And we need to get the charlatans out of the health industry of Myanmar. And we need to come crashing in with the World Health Organization and do some serious medical intervention in that country. And we cannot ignore it any longer. This is a critical and necessary thing at this time in history.